So in this video, I'm gonna share with you my Competency Assessment Program clinical placement for 6 weeks at Ashburton Hospital. Hello everyone, it's me again, Sai. Welcome back to my channel. If it's your first time here, make sure to subscribe and click the bell so you'll be notified whenever I have new videos. This is the part 2 of my Competency Assessment Program experience. So if you haven't watched the part 1 yet, please click here. So you will know what I did during my theory week for 2 weeks at ARA Institute in Christchurch. So in this video, I'm gonna share with you my Competency Assessment Program clinical placement for 6 weeks at Ashburton Hospital. Before I start, I would like to quickly greet all the amazing nurses I have worked with at Ashburton Hospital. To our nurse manager, Diana Kerr, my clinical liaison nurse, Jenny Lansdowne, and all my body nurses, Naomi, Carl, Michelle, Jingle, Priscilla, Lydia, Faye, Fiona, and a lot more to mention. I miss you all and I hope you're doing all great. Okay, so let's start. So after doing the theory week for 2 weeks at ARA Institute in Christchurch, I moved to Ashburton and I stayed at the nursing hostel of Ashburton Hospital, which was very affordable. I think it's around $110 per week if I'm not mistaken, and it's just 5-minute walk going to the hospital, which is very convenient. So if you will do your CAP at ARA and you live here in Auckland, so there's a high chance that you will do your placement at Ashburton Hospital as well. So don't be scared because Ashburton Hospital has a lot of friendly nurses. So especially in Ward 2 where I've done my hospital training for 6 weeks. So Ward 2 is a rehabilitation area while Ward 1 is a medical area. So mostly in Ward 2 the cases of the patients are fractures. So there are a lot of times that I used hoist, e-tac, and walking frame for patient transfers. So for 6 weeks, I've worked with different nurses who are working at Ashburton Hospital. So for 3 weeks, I did the morning shift and then another 3 weeks afternoon shift. I'm not sure if your school will also ask you to do the portfolio like this one. So there are a lot of things I did during the clinical placement. So I'm gonna share it with you. Okay, the first thing I did was the rapid assessment like this. So rapid assessment is what you will assess to the patient based on what you see right at that very moment. So you will check the airway, breathing, circulation, what is the disability of your patient, and you will take the the vital signs, and then you also need to do a concept map. So a concept map is where you will do the pathophysiology of the case of your patient. So keep in mind that you need a signed consent by your body nurse prior to any assessment that you will do with your patient. And then another thing I did was the comprehensive assessment. Comprehensive assessment is a cephalocaudal assessment with your patient's diagnosis or condition. I also did a drug study. So the drug study are the medications that your patient is currently taking. So you need to explain the adverse reaction, what is the nursing consideration when giving that medication, so the dose, etc. I also did patient education. So since my patient was using a PICC line like this, so I gave some information about how to take care of the PICC line and what's the PICC line for. So you will also do the same when you do your competency assessment program at ARA. I also did a formative assessment. So formative assessment is all about Nursing Council New Zealand competencies. So there are a lot of competencies, so I will explain this to you in a separate video. So for 6 weeks, I have completed everything based on my personal experiences with my patient, so with their cases. So yeah, I will explain further about this in my next video. And the next one is the summative assessment. The summative assessment is the completed formative assessment, which will be signed by your clinical liaison nurse and your body nurse. So after 6 weeks at Ashburton Hospital, I moved back to ARA Institute in Christchurch to do the final week, which is about oral presentation or reporting. So before we did our clinical placement, the school already provided topic for each student, and my topic was about frailty or sarcopenia. So that's the last part of my competency assessment program at ARA Institute. Also, the clinical liaison nurse will assess your English proficiency. So that is part of the portfolio. So that's about it. If you have any questions, please leave them in the comment section below. And if you find this video helpful, please give it a like and feel free to share this video to others. And yes, I will see you in my next video. Thanks for watching. Bye!